So we're going to be going into week 2. We're going over infants, toddlers, and preschoolers. We're going to be doing a PowerPoint on a wall of them, of course. We do a cahoots right after infants. Infants is the biggest growth and development there is. If we look at the first year of life, what happens? They go from not even being able to lift their head till they're walking and talking. It's amazing. They've tripled their birth weight. It's amazing how quickly they grow. From there on, it's not as much and as distinctive. It slows right down. So I do go over the infants quite intensively with the cahoots to follow. Then I do toddler preschool together. Toddlers and preschoolers are similar, okay? Preschoolers are a little older, so they have a little less stress. They can understand things a little better. Toddlers are the ones that need the more nurturing and needs the routines, etc. So let's go ahead. Anybody with any questions about anything? Know that, remember, next week we're going to be doing our reviews. I do mine on Tuesday at 6 p.m. You will be getting at midnight tonight the list of all of the cahoots that we've done. The study guide, the PowerPoint study guide, and you're going to get a medication calculation exam 1 sheet. So it goes over those types of questions that you might see on the exam. So everything is there. Know that the recordings, as I get them, I'll be putting it in one announcement. It's not going to be 8 announcements. It's one. It will say exam 1 recordings. And then you can go through and I will just edit it as it goes. And I'll put one in as they come. You have 2 on Monday. In fact, every day of the week, you have a review from Monday to Sunday. So some are mornings, some are evenings. So you've got a great thing. Make sure you listen to 2. I always suggest me, listen to mine, and some other person, whoever you relate to, whoever makes sense to you. We all teach slightly different. So pick someone else, and that just gives you another view and it helps you remember it, okay? The
Um, I
discussion
I
question.
have a
Go
quick
ahead.
question. Sorry.
Good.
Your review next week. If we're not able to attend, will that be recorded?
Everything's recorded. We'll be on one announcement, absolutely. And you know how quick I put my recordings up. They're within the hour after I get them done. I don't wait till later the next day if all possible. I like you to get them as quick as I can because some of you want to come home right away and start reviewing because there's 8 different recordings you can see and your lives are a little busy at this point in time. So I understand that. So let's go ahead and do our today. So infants, most of the time today is spent basically on infants because, as I said, this is the most growth and development you see. So right there, most dramatic during infancy is the big growth. They go from not lifting their head up, not being able to breathe, suck, and swallow, up to talking, feeding themselves, and walking or attempting to walk in 12 months. That's quite amazing. We know if this child doesn't get proper nutrition and care, they're not going to develop cognitively and physically the way that they should. We should be seeing them gain weight. Yes, initially they lose their 10% of weight, yes, and they gain it within 2 weeks. They get it all back. And they should be gaining somewhere between 5 to 7 ounces a week. By 6 months, their weight will be doubled. By 1 year, their weight will be tripled. These are important growth and development milestones because if we're not feeding enough, the weight's not going to reflect it. Therefore, you're not giving that gasoline in the tank and you're not giving cognitively what they need to grow and mature and be healthy, smart children. So, again, weight is so important. How do we measure nutrition? Height and weight, cognitive development. Right there. That is it in a nutshell. The first 6 months of life, do you know a baby grows 1 inch a month? It's amazing. And we know they get pudgy and then they get taller, pudgy, taller. And it's just what all children of all ages do. Now, as we get older, babies' vital signs change, right? We call it the maturation of systems. Our heart and our lungs don't have to beat as much for a neonate, those first 28 days of life, as we would do for an adult. And it's evidenced by looking at heart rate, looking at respiratory rate, and of course, the blood pressures are changed too. So at birth, a neonate, heart rate, 140 to 160. At rest, normal, absolutely normal. Respiratory rate, 40 to 60. By the time we get to be 1 year old, now I've given you a guide, not an exact numbers on that vital sign sheet. It just shows you numbers come down from heart rate and respiratory rate as you grow older. And the reason why you need to know that is, for instance, if you're giving medications and you have to know a heart rate, or if you're trying to figure out, are they dehydrated? Do they have a fever? Are they in pain? Is that elevated for that child? These are the reasons why you need to know basically where your numbers should be, okay? Babies are born with mommy's blood, mommy's hemoglobin, iron, and all of the antigens and immune system that she can, right? Well, we know all that stuff tends to die off and goes away. That's why we tend to give all of these immunizations really quick. I don't know if you had a chance, but in the book, there's 2 pages of immunizations. Like, how do you need to know all of these things? And I'll be going over them and which ones you really need to know. I mean, the first one that you've heard about, we've talked about, hepatitis B, given at birth. Yes, you need to know that one. We know as they get older that 2, 4, 6 months, we give a lot. We don't give flu vaccines till 6 months. And then we keep going further, and there's more, and we'll go in another slide as we get going. Now, the head. When the baby is born, heads are bigger than their chest circumference. This is an important thing to know. We know the head comes out, then the rest of the body slides out easily, right? I guess it stretches it and gets it ready for a vaginal delivery. Now, as the baby grows, when they're about 1 to 1.5, their head and their chest should be equal, or their head should be smaller than their chest. If we're finding out the head is still remaining big, we need to find out, why is it still big? Is there a tumor, hydrocephalus? What's going on there? One of the things we do look at is, of course, we're doing head circumferences on all newborns. It's just something we do as part of our assessment. And we'll be looking at fontanelles. Now, the one on top, the soft spot, is the one that we always think about. That's the anterior fontanelle. That's the last one to close. A year and a half, it closes. The one in the back of the head is called a posterior fontanelle, and it closes really quick. And it's actually very small, so you barely even see it there, okay? As the baby gets older, they hear better, and we also know they see better. At birth, they only see with one eye, looking here, and the other eye here. They don't work together yet. So that means they're a little confused of depth perception. If they were walking, they don't know where they're walking because each eye's going in the wrong place. But it has to do with depth perception as a young child. Their immune systems gets more and more and better and better as they get older. It has to do with the immunizations. It has to do with getting illnesses. If they're breastfed, mommy's giving immunity every time she breastfeeds them. We know that by 9 months, a baby's making their own, immunity, taking those vaccines, getting illnesses, making their own antigens, antibodies, and fighting for them. And as we get older, we get more and more diseases, etc., and our immune system becomes stronger and stronger. Thermal regulation. This is babies when they're born. They're born from a nice, warm, very wet environment. They come out into the cold air and they're wet. So what happens? They get cold quickly. They have nothing to fight against it. So they're just going to shiver because they're cold, burning calories. And also, something I learned from a mistake I made is that if a baby gets cold, their heart rate comes down. And I learned that after I gave a bath to a baby and forgot to turn the warmer back on. And they were colder and the heart rate went down. And I went, what's going on here? And I figured out it was cold, believe it or not. So you don't want them to be cold. So what do we do to newborn babies? We dry them off vigorously, we put a hat on them, and we put them underneath a radiant warmer with heat because they cannot regulate. It has to do with all that fluid they've soaked in, the extracellular fluid. It's all that, wetness. Babies are born, puffy eyes are just so swollen with all this fluid. I think it's pretty neat how you send these babies to the newborn nursery for an assessment and they come back and they don't look those puffy baby. Looks like a beautiful baby then, right? Their faces actually change because of all that extra fluid now has been, they've urinated it out. Now, there's fine motor development and gross motor development. Fine motor development is their F for fingers. When you have these questions, be careful. Fine motor, gross motor are different. Fine motor is F, what you do with your fingers, your hands. Gross motor is get up and go, 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 movement, muscles, okay? When you're doing these questions, read what it's asking for. Fine motor is another word for grasping, is prehension. I have no jingle-lingle thing to help you remember that word. It's called prehension. It's when they start grasping things, whether it's an involuntary reflex or a voluntary one. Now, the first grasp that an infant does is a palmar grasp, and the first one is a reflex. Now, I've heard this over and over again. Mommy's standing there by the warmer by their baby, and the baby grabs their finger and gives it a hug. And mommy goes, oh, look, the baby grabbed my finger. He's giving me a hug. Oh, he knows who I am. He loves me. Don't you dare tell them that was a reflex. Let them know that the baby does love them and they are giving them a hug. Do not ruin that, because if they're in a hospital in a warmer, this is a time where they're already nervous. Let them have that moment of baby gave me a hug. It was a reflex. Then what happens? Then they get into what we call a voluntary palmar, where all of a sudden there's something in front of them and they grasp it and they grab it and they hold on to it. And from that, they learn so many things. Then about 7 months old, they can take it from one hand and voluntarily move it to another, back and forth if they want. By about 10 months, we put them in high chairs and they're feeding themselves things off the high chair, right? When they take it off the high chair with their hands and smush it in their face, that's a pincer grasp. It starts with not a thumb and a forefinger, it starts with a smush. And it ends up eventually, they can get the thumb and forefinger and one at a time. They can pick them up. So pincer grasp starts about 10 months, and then it starts crude, and then it becomes fine. By 11 months old, with their hands, their fingers, they can take things out of objects. And by 1 year, a minimum they should be able to do is build a block of 2. You could build 4 or 5. As long as it's 2, we're doing okay. And that's a test for you. Now, gross motor skills. Remember, look at the question. Is it fine motor, fingers, or is it gross motor? Get up and go, go, go movement. So, muscles, movement. What does it start with? The first gross motor skill is head control. They pick their head up about 2 to 3 months. They start to get their head and neck control. By 5 months, they're turning from their bellies to their back. And by 6 months, they should go from their back, turn over to their belly. Now, once they can roll, this is a safety tip you need to teach your parents or whoever's taking care of that child. This child will roll off of anything now. I cannot tell you how many children about 7, 8 months that were run into the emergency room because the baby had fallen off a high chair, fall out of a changing table, or off a table, a couch, and onto cement floors, and they were screaming and got a big black and blue. Teaching safety, they're rolling by 6 months, completely over. Safety tip. Another thing about gross motor, most tested of all the skills, sitting unsupported by 8 months old. Initially we stick pillows around, right? And hold them up because they're a little bit wobbly. Well, no, at 8 months old, they should be able to sit there on the floor by themselves and nothing supporting them. By 10 months, they should be able to go from their back and they should be able to sit themselves up from that position. Now, the picture to the right, see how you hold the hands and the head falls back? That's called a head lag. When should you not have a head lag? When you get neck and head control, which is about 2 to 3 months. So if we see at 6, 7 months that head is still lagging back when you pick them up by the hands, that's a growth and development problem. They're not cognitively where they should be. Okay? Head lag, that's what it's called. Now, let's look at the motor. It's cephalocaudal. It starts with the head movement and ends with the feet. Caudal are feet. So we know that we're rolling over by 6 months. Now we're up on our knees, crawling by 6 or 7 months. And I know they always go backwards before they go forward. And then they're creeping. Do you know what creeping means? They're on the side of a couch or a coffee table or something. They're holding on and they're walking on and searching the environment. By 11 months, they should be able to walk holding your hand or onto something. And by 1 year, they should be able to walk alone or attempt to walk alone. That's your gross motor sequence of events. Now, I'll tell you, sometimes they skip things, okay? As long as they're going forward, they're okay. And I think the best example, my grandson's 1 on Saturday. He doesn't crawl. But put him up in a walker and he will run all over the place and stand up and attempt to walk. But he does not crawl. As long as he's moving forward, we're okay. And cognitively, everything else is there. Kids are so difficult, aren't they? They're all different and there's no two the same. So nutrition. First 6 months, only breast milk or iron fortified formula. If the choice is breast milk, that baby must be given vitamin D supplements. It helps with good muscle and bone support, so it must be given. They say breastfeeding or iron fortified formula should be for the first year of life. You do not change to whole milk, full fat, no skim milk, none of that. Full fat whole milk can be started at 1 year old. They need the fat for their brains for good central nervous system development. They need the fat. Even if they're overweight, they need the fat from the milk. Another thing about feeding and newborns, no honey till they're 1 year old. When I moved to Miami from a small town in New York, I would hear parents or grandparents say, oh, give a little carrot syrup or a little honey. That will help the constipation. Those things, there's no sort of government about them, about sterilization, sanitation, making sure, they botulism. How about the side of the street, honey stands? They're all over where I am down in Miami and Homestead. So I'm saying you don't know if they're healthy enough for your baby. So some of the tricks: no whole milk till 1 year old. They have to have breast milk or iron fortified formula up to that point, and no honey till they're 1 year old. And actually, some of them say up to 2 years old. The one thing about nutrition, the one thing that you will hear is, let's say you had a baby in the newborn ICU or one of the ICUs at birth. And, we've been measuring their bottles, we've been weighing their diapers, and they go home and now they're putting them to breast. They don't know how much they're eating. I don't know if my baby's getting enough nutrition. How would you tell that parent to monitor how much they're getting in? Well, 6 to 8 wet diapers. That's it. That's all you need to see. And when they're going to the doctors, newborn, 2 weeks, 2 months, 4 months, 6 months, you're weighing them and they're gaining weight and gaining height as you're going. They're getting enough nutrition. Now, at birth, we don't give them food. And the reason is because the gastrointestinal tract is immature, which means you give them the food, all it does is upset the stomach, and it just comes out the other end and it's just macerated, but not all the nutrients can go in. In fact, it's more trouble than it's worth, basically. So what they say is only breast milk, iron fortified formula till they're 6 months old. There's one time that we will give food earlier, and that's if the baby has reflux. That means they're spitting up, they're losing formula. Every time they eat, they can't keep it down. Reflux keeps coming up. We put a little bit of rice cereal, either as a spoon it before they breastfeed or in the bottle, actually, with formula, and it thickens the formula enough to hold it down. Now, the rice cereal is not giving them real nutrition. It's that not vomiting out the calories or keeping it in. That's how they increase the nutrition. So the second 6 months of life, this is when we start to feed these babies. Remember, food is always given before milk. Okay? How do we start to feed these children? Well, they do say the least allergenic of all these things is actually rice cereal. They say to start there. You are to give one food at a time every 4 to 7 days, and you're looking for allergies. Allergies could be anything from a rash to abdominal pain to eczema, anaphylaxis. It could be all the above. So you've got to be very careful with feeding these children. And then you're going to say, well, what do you feed first, second, and third? Usually it's a doctor's choice. The doctor will say, start with this, and then you can add this and that. Or they'll say, whatever you want, one at a time, 4 to 7 days in between. So these food sensitivities, I picked some really bizarre looking things here, but this is eczema and psoriasis of the young child, and it happens. And it's just an allergy to environment, creams, lotions, foods, could be anything. And again, the thing with these is try to desensitize them and try to get them able to eat the foods and, of course, alleviating the itch and all the stuff that goes on with that. Babies, hopefully, by 3 or 4 months old, can sleep through the night. I was blessed with my last grandson, as the one is turning 1. This baby has been sleeping since about 3 months old for 12 hours at night. No bottle, no diaper change, no nothing. This kid would sleep all night long, but that's a very unusual thing. My daughter got blessed. We know breastfed babies wake up more frequently. They actually consider breast milk a clear liquid and formula not. So you can see formula is a little bit more substance to it, so it lasts longer. It's the only way I can describe it. And we know babies nap 1 time, 2 times, 3 times a day, whatever. And the book tells you the walkers, the swings, the playpens, none of it's necessary, but all of them have it because every baby needs to have a walk and a swing and all those sort of things because they're fun and the kids like them, right? And parents like them. Now, dental health. Babies could get their first tooth at 6 months old. Most babies don't get a tooth at 6 months. Some do, but that's usually the first one. If your baby is 8 months old, We know the possibility of teeth is 2. 6 minus 8 is 2 teeth. My children never had teeth at 1 year old. At 15 months, they got 6 teeth at the same time. Can you imagine all that teething all at once? Yes, they did get some Tylenol and some icy stuff for their mouths. But again, uh, teeth can be that, the child being really upset and crying. With the teeth, as soon as they get them, you're to brush it with a soft toothbrush, just water, no toothpaste. Just keep it clean. And to protect those teeth, you're not to have anything with milk, sugar, juice, and a bottle in the bed so that they can hold it in their mouth and they will rot their teeth. And I've seen it. My son, my firstborn son, had mouth rot because of a bottle that he used to hold in his mouth all the time. I didn't know better. I wasn't peds then. Pacifier use. Do we like it? Don't we like it? Well, I've seen research go both ways. Today, research has proven a pacifier does comfort a child. It does. It's one of those necessary things for them. So again, they are promoting pacifier. Here's all your immunizations. Remember, Hep B, it's not just one shot. Remember, there's a 3-shot series in that throughout their lifetime, okay? Know that measles, mumps, rubella is not given till 1 year old. Varicella, not till that 1.5 years old too. And remember, influenza, not till 6 months. Things that can happen to infants is their heads can get smushed on his side. I think the biggest thing parents are telling us today is that with this back to sleep to prevent SIDS death, their backs of their heads are getting flat and parents don't like it. And they're like, what can I do? My baby's head is flat. I don't like it. Well, the first thing that we can promote is tummy time. Baby scalps are soft, bones are malleable, and getting them up off the back of their head actually gives it enough time to round it out. And not many children need that helmet on their head. Now, some of them do, due to whatever reason. And that helmet just helps that head mold. I've seen them in the grocery store. I used to wonder what they were before I worked pediatrics, and then I found out. Diaper rash. This is the dreaded thing that happens that we're going to keep parents awake all night long. Whenever a baby urinates or stools, it burns and it hurts and they cry. So that's that cause of many sleepless nights, right? It's caused by many things. Now, the way that looks up and down, that looks like a diaper. Could that be my kids could not wear Pampers? They only could wear Huggies. My grandson can only wear Pampers and not Huggies. So again, every kid is different. And you could tell because you put it on the diaper and it turned red. It also can be soap detergents, bath creams, lotions, gels, all of that stuff, anything. All of those things can cause diaper rash. So just to be aware of it. Food allergies are big and they are real. So again, it could be part of food allergies and it's managing that also. Cradle cap, flaky head. How do we treat it? Well, it's dry skin. So we need to moisturize it. Many parents like to put moisture oil on it. And then in the morning or late at night, whatever their routine is, wash it normally. And then take a nice soft brush comb and brush it out. Now, it's not going to be done in one time. It's going to be several times. It could be a week or 2 or more, but with all that extra creams and lotion, you can get it. It's a nice, good scalp. Now, sudden infant death syndrome. This has been studied since I went into pediatrics in the 90s, okay? Something that they've looked at. And what their newest thing that they say is babies that are put on their backs to go to sleep has a decrease in sudden infant death syndrome or sudden deaths of infants. Remember, SIDS is the first year of life. It's only for 1 year. The peak ages are ages 2 to 4 months, okay? It is more males than females. It's because babies are put on their tummies to sleep. Cigarette smoke is another one in there. Remember, cigarette smoke also causes ear infection in kids, so no smoking around children. Having these kids too hot. What if they've had a viral infection and they have, some nasal mucus? That could be one of the setups, risk factors for SIDS death. Babies are obligatory nose breathers. So what about suck, swallow, breathe, and my nose is all clogged up? That's when those things do happen. It also happens to children that are not breastfed. Breastfed baby have a decreased incidence of SIDS death. Immunizations need to be up to date. If they're not, usually that can cause it. And then putting them on a firm mattress, nothing soft they can smush their face into. Now, one of the things that's scary to parents, and I've seen happen quite a few times, is something called ALTI, or an apparent life-threatening event. And what happens is the baby chokes, gags, and stops breathing. And the baby turns cyanotic, blue, and dusky, and the parents freak out and run right into the emergency room. It could be due to two different things. Is it reflux that caused it, or is it neurological? These babies are all admitted to the hospital, and they work them up for reflux and they work them up for seizures, something going on in the brain. Okay, so we call it the $1 million workup because it is. That thing that you see, that machine there, is called the apnea monitor. And we do use them, send parents home with them. And it's so easy. You turn it on, you set the alarms, and it works. There's just a strap with a Velcro, and the probes go on either side of the nipple. That's it. And when that alarms, it will wake the dead. It is a loud, sharp, ear-piercing noise that comes around. So car seats, motor vehicle. Remember, infants need to be in a back seat and they need to be rear facing. We don't turn them around till they're 2 or 30 pounds. That's what they say about that. And it's something that we need to teach. Remember, it's not just doing it and having the car seat in the right place, making sure shoulder straps are snug. Younger kids taking blanket rolls and rolling them in or padding underneath their buttocks. These are things that make it nice and tight and secure for that infant. One of the things our job will always be in nursing with children will always be about teaching safety. I mean, today people are having babies. A lot of them are having infant CPR. It's part of the program that's used. Water safety is older kids, and making sure the kids get it. You can save lives if kids know how to take care of themselves. Now, Latasha's a breastfed infant. She's seen in the clinic for her 6-month checkup. Her mother tells the nurse that Latasha recently began to suck her thumb. Which of the following is the best nursing intervention? What are you going to tell this mother?
I feel like it's normal.
Absolutely normal. It's absolutely normal. Remember, children explore the world through their mouths, right? And if it's their thumb that's going in there, she's at the clinic. She's stressed. She's self-soothing with that thumb in her mouth. So she's done absolutely the right thing, and you didn't have to do it for her. Okay, now we're going to go into theorists. There are 6 or 7 questions on your exam on this. Very important. I'm going to try to explain it in a manner that's going to help. Okay? Erickson and the infant. Erickson talks about the people and how they interact with the child. So how do people interact with an infant? Baby cries, somebody comes, picks them up, feeds them, changes. Baby's happy, right? That is a trusting relationship. Erickson says when baby gets all needs met, they're happy, healthy, and they're vibrant children because everything and their needs are met. There are incidences where not just once, but most of the time, an infant, when they cry, is not picked up and their needs are not met. This child has learned mistrust. Usually it's in situations like maybe homelessness and poverty, maybe it has to do with drug abuse, alcohol abuse. Something is not right in that family situation where this child is not getting what they need. There's something else going on. And these kids end up acting out. They could be reaching out and biting and doing things like that because they're not getting what they need. Now, Piaget, this theorist, talks about their brain. So let's go back to a newborn. A newborn does not know how to breathe at birth. You have to teach it. So you smack their butt, and they go, oh, and they take a breath and they continue to breathe, right? Then what happens? They put a nipple or a bottle in their mouth and they learn to suck, swallow, and breathe. So there is a set of schemas or things that have to happen and you build on them to get where you need to go. And let me explain that. So initially, you have a reflex grasp. And then eventually you see this rattle and you go, oh, I want it. And you voluntarily grab it. You don't know what to do with it. You just grab it because you could. And then all of a sudden you move that rattle and it made noise. Ooh, I like that. So you're making noise. Sensory motor. Okay, it's part of sensory motor. Touch, movement, sound. Okay, in the mouth. This is all what they do. Next time it falls in their mouth. Now they're doing it all. So now they're moving it, shaking it, it's in their mouth because they learned how to grasp first and they shook it and found it. So we started out with a simple grasp and now we're moving it all over, playing with it, and it's in the mouth and soothing ourselves. This is what infants do. They learn from little and build it up into the more complicated. So sensory motor, it's the first 2 years of life. Everything is touch, movement, in the mouth. Let me check this thing out. This is that exploration. As we get older, and that we'll do in the toddler whatnot, but let me just explain it. As we get a little bit older, now we're starting to get a little bit more understanding of our environment. And now we start to get a little magical. So now a block becomes a car. Whee! And I go down the table, oh, up in the air. Oh, let me throw it over there, right? This is what kids do. They take things magically and make it things. My arm's out. Whee! I'm an airplane. Whee! I'm on a broom. I'm riding a horsey. This is that pre-operational, okay? So we start out with figuring things out. Now we're becoming magical, and now we're doing all of this magical thinking and playing. Infants, they're going to start looking at everything. Feet in the mouth, hands in their mouth, everything in their mouth. They're just looking at their whole bodies, trying to figure out, what do I do with these things, right? They don't know that they're theirs and what they're there for. They have to figure these out. So we're looking and feeling and feet and all those things. Also, they're learning that if mommy gives them a toy and they hide it, they know it's still going to be there. And again, that's object permanence. They know just because it's not seen, it's not visible, they know it's going to be there and they'll go looking. I mean, just think about a toddler, a younger kid, a little bit older than infant that's walking and more mobile. They want their favorite toy in the morning. They go to the toy box or where they left it and they pull it out and they continue to play because object permanence. They knew that it was still going to be there. Social development. We know that usually babies are really attached to mommy, dad, caregiver for sure. And it's sometimes hard to get those babies away as a nurse to do our assessment, weights, whatever we have to do. Separation anxiety. It's 3 stages. And in the toddlers, what happens is these kids, separation anxiety happens when mommy or daddy can't stay and they're in a hospital. And what happens? That toddler starts screaming and crying, even preschoolers screaming, crying, like, oh, daddy, daddy, mommy, mommy. Ah! And then, you can hear them down the hall and, the next floor over. They really get quite upset. That's the first stage of separation anxiety. After a while, they realize nobody's coming back. They had to go. My screaming and crying ain't doing nothing. So now they regress. It could be they stick a finger in their mouth, start sucking their thumb. They could become incontinent when they're potty trained. They want a sippy cup when they don't usually use these sort of things. It's that regression that gives them comfort. The third stage, caregiver comes back, mommy, daddy, whoever, and that child ignores them. Why? Isn't it exciting? Mommy, daddy's back. No, because they're going to leave me again and I don't want to get upset again. So I'm going to pay attention to the nurse and this one that's been playing with me for the last day and you haven't been here. 3 stages, separation anxiety, very important. Baby has stranger fears. They know that they're going to play peekaboo with us. I mean, that's just part of it. Babies are going to start learning more and more how to talk and coo and imitate and all those good things. It just happens. So let's do our first cahoots. Who wants to win the first cahoot? Alessa, is it you? No, maybe. Mercy, it's you. Oh, it's Avery. I see that look. Must be. So again, you can either go through that Q code up there, or you can go to kahoot.it and enter the PIN number. I think it's easy through the Q code. Put the camera up there, take a picture of it, and you go exactly where you need to be. Remember, I don't look at the results of this. These games are for you. These are an immediate test of your knowledge, okay? This is not for me to go and say, well, you didn't know this and you didn't know that and you didn't answer that right. No, you're the one who has to take the information and use it. All right, let's get going. Kahoot! Infants. There's, I think, 27, if I'm not mistaken. Yep. In general, an infant should triple their birth weight at blank months of age. So we're going to triple it by they are 12 months old. And if they're not, they're weighing too much, there's an intervention. Too little, there's an intervention. An infant should blank their birth weight by 6 months old. So we know they're going to double by 6 months, triple by 1 year. And do you know when they quadruple? Age 2.5. That's how long it takes to get there. You see what first year does? A lot. Infant nutrition includes So, infant nutrition, we're not going to give honey or whole milk till they're 1 year old. Remember, one food at a time every 4 to 7 days. So, for 4 days, you need to feed the same food, up to 7 days, depending on the allergies on this child. Finger foods, absolutely, they need it. They need to do that pincer grass. They need to smush it by a crude pincer in their face. Very important tactile for these children. Sense pleasures, finger food. A multi. Infant nutrition for the first 6 months. First 6 months is only breast milk and iron fortified formula. Now, iron fortified formula can be lactose free, soy, this, that, the other. Yes, but it's iron fortified formula. That's the bottom line. Doesn't matter the other stuff, okay? A multi. Nursing interventions for an infant include nutrition. What do we know? No honey, no whole milk until 1 year old. If they can't breastfeed anymore, they're going to get iron fortified formula until 1 year old. Remember, breastfed babies need to get vitamin D for their good bone and muscle health. Formulas must be iron fortified because the iron, the blood cells they're dying, and we need that extra iron in the diet because we're losing it. And again, one food at a time, and you keep that same food for 4 to 7 days, and then you add a new one. An 8-month-old infant should be expected to perform which fine motor skills? So F is fine as fingers. So what do we do with that? By 8 months old, they should be able to grasp a rattle, and they're going to do that crude pincer grasp. It's that 10 months we get more into that fine pincer grasp, okay? We're not putting anything in objects or taking out or in by 11 months, and the blocks are not till 12 months. Which of the following is an example of fine motor skills in infants? So F is for fingers, fine. So the only thing there that had anything to do with the hands was grasping an object. Crawling, rolling, and jumping are all moving. Those are get up and go, go, goes. Those are gross motor. Most of you got it. Good job. Which is the correct order of development of gross motor skills in an infant? What do they do first? What do they do last? So the best of all these sequences, holding their head up, rolling over, head steady, and they're sitting, they're stands, they stand, and then they walk. At what age can an infant typically sit unsupported? So that should be right about 8 months old. As I said, this is always a question, and it's asked in many different ways. Which one can they do? Which can't they do? What would you report? What don't you report? And it's always something to do with sitting unsupported, knowing that that's 8 months, okay? At what age does an infant typically start rolling over? Rolling over, when do they roll? Starts to roll over. And we know they start at 5 months. At 6 months, they're completely rolling over. And this is a concern because we're going to teach safety. I don't want to see another child in the ER because they rolled off of a changing table, a bed, a table, or whatever, because they come running in. An infant's head circumference is so a head circumference on an infant, we know that their heads are big at birth. And hopefully by 1 year, 15, 18 months, they're going to be equal to the chest or it's going to be smaller than it. Again, this is one of those growth and development. We're looking at the head. Is there hydrocephalus? There's a tumor. Is there a problem with it? Again, it was something that we're going to see that's going to alert us. How do you apply nystatin to an infant with thrush? Again, this is just showing you change of practice. Why do we do it to an adult? We had thrush on an adult. It's a swish and swallow, right? But we're an infant. So they can't do that. You're not going to squirt it. Just take and paint it exactly where that white stuff is all over their tongue. That's it. Use a cotton swab. Blank is contraindicated for treating fever in children. One thing we do not give kids for fever is aspirin. Aspirin can cause Ray's disease. It's a metabolic problem. It's usually aspirin following a viral illness can cause Ray's disease. So we do not give aspirin. There's one condition that you'll be taught in week 5 that we give aspirin for because we use it as a blood thinner, okay? But acetaminophen is the only thing for the first 6 months of life. At 6 months old, we can introduce ibuprofen. We don't do it earlier than that because ibuprofen, NSAIDs has to do with bleeding problems, something to do with platelet and infants that can't tolerate it. So you have to wait till they're 6 months old. What is the primary goal in treating a fever? Why do you treat a fever? So the reason why we treat a fever is not because it's dangerous or anything. Actually, once they have a fever, the chances of seizures are go way, way, way down. We give them stuff for a fever because it takes care of them feeling horrible, that discomfort. How do you feel when you have a fever? You feel horrible. Now, how do you treat a fever? Well, you give them something, medication, but it's also fluids. A child will not drink anything if they have a fever. They feel sick. They don't want to drink. So give them something for their fever. Temperature comes down. Now they're up. They're running around like they're not sick at all. And now they're drinking, which is what you wanted. Infants Erickson stage is what? Or Erickson's infant stage. What an infant needs is to trust that somebody's going to take care of them. As simple as that. Which pain scale is used to assess an infant? And that's going to be FLAC. From 0 to 3 is going to be FLAC. Also, nonverbal children. And that could be an 18-year-old cerebral palsy, nonverbal, that you could still use FLAC on them. A multi. When is the best time to assess an infant? It's difficult enough to be able to assess an infant because they don't lay still. They're always cooing and moving and gooing, right? So the best time is when they're as quiet as they can be. Maybe when mommy's holding them, they're quiet and calm. It would be a good time. The other time, when they're sleeping. It's very hard to listen to heart sounds, breath sounds, bowel sounds on children, but that actually is the two best times during it. Mealtime, they're too active, and you're not going to hear. And they're crying, you can't hear a thing. Where should you place a car seat for an infant under the age of 1? That's sort of a redundancy, right? Car seat for an infant, and infants are under the age of 1. Car seats for infants less than 2, less than 30 pounds must be back seat, rear facing, and they say put them in the middle. We always put them under behind the passenger side, right? So the driver's side could see it. They're saying nope, put it in the middle. Which of these does tummy time help with? So tummy time gets them off their head. So it helps with that plagiocephaly. It also helps because now that's object permanence and they're looking for their toys and they're moving and squishy and they're trying to get there. Or you're just playing with the baby and making them move. It's that development of muscles and the coordination. Which newborn can have ABO incompatibility? This causes hyperbilirubinemia or jaundice in the newborn. And how do we take care of it? Usually we think ABO compatibility, all right, they're going to get the shot for the next time. But also at this point, we're jaundiced. How do we take care of ABO compatibility? Well, number one, fluids help. We know that. We know the lights protecting their eyes, that can help. But the biggest thing on treating ABO compatibility is feeding them and making them stool if they can, because bilirubin comes out in the stool. So, which intervention may decrease the incidence of physiologic jaundice in a healthy term infant? You have many babies that are borderline that could require lights, maybe decreased discharge, etc. And then as a nurse, if we know that number one, if we feed these kids immediately and get their bowels moving and get that bilirubin out, we might actually stop them from going into the point where they need lights. And all they need to do is keep feeding, keep them hydrated. An infant is NPO due to their medical condition. What's important to remember? Many babies are born and due to whatever, they can't eat, whether through a tube or through their mouth or anything. So what would you do? Remember, they're still an infant. They still go through a lot. They still got stress going on in their lives. And they need normal growth and development. And the one thing to remember is to give them a pacifier. This helps them, their own stress. It soothes them. It's a comforting thing for them. A multi. The mother of a child suspected of having Munchausen syndrome. What should be in the care plan? Now, this is actually on the next part of the PowerPoint. And I just wanted to mention it because I've only seen one in my career. And what it is, it's the caregiver wants the baby sick, so they keep them sick. They keep wounds dirty, or they have them swallow things that make them look sick. And it's usually the caregiver. So what's our responsibility to a child that's possible neglect, abuse, or in a mush housing syndrome? Well, our position will always be to protect the child. So we cannot come out and say, you are a mushhauser, whoever it is. But what we can do is we can say, when they walk in the room, somebody's in that room with that child at all times if that person is there. And we will also check anything they bring in. Sometimes they bring in foods to keep them sick, or soup, or this or that, or items that have things on it that can get them sick. So again, that's mush housing. Protect them. All right. Somebody in the room. Number two, make sure they're not getting anything in the room that could hurt them more. Multi. Frequent developmental assessments are important for which of the following reasons? Developmental assessments. This is telling you how your baby's growing, their height, their weight, cognitive level. You're telling me, is my nutrition good? And if nutrition is good, everything, well, then what else is going on? So this is happening. Let's go ahead and identify it. And let's institute early intervention if that's what it needs. Kids do well with interventions. The earliest we can get that intervention, the better it is for them. A moral reflex. Startle. What is that? There's a couple reflexes about children you need to know, and this is one of them. The startle. You walk into a room and you hit the crib, and that baby takes his hands and goes, and legs go up, and that's a startle reflex. Like, and you can see them. Everything opens, their legs go up in the air, and so do their hands. Startle reflex. Absolutely normal. A multi. What are risk factors for SIDS? So SIDS, we know males are more than females, so gender is one. Secondhand smoke, that's a big thing. Remember ear infection with that also. If they've had a viral infection, they've got their noses clogged up because of the mucus. They can't suck, swallow, breathe. They're going to get probably incidence increase a lot. Also, breastfeeding decreases the risk factor. In fact, that's one of the reasons why they encourage breastfeeding. And last question, the rooting reflex. It's when you take and you stroke the chin with your finger. And what happens? That baby turns, and what are they looking for? They're looking for a nipple, or they're looking for a bottle. This is all they're looking for, is to help them feed. In fact, it's one of the things that we teach breastfeeding mothers, especially new breastfeeding mothers. Stroke the cheeks of the baby will try to look and try to latch onto your nipple. Ali, good job. Number two, Hunter. Number one, drum roll, ding, ding, ding. Tempest, good job, Tempest. Number four, Miranda and Mercy. All right, we're going to keep continuing now, going onward, and then we'll go to the next cahoots, which is going to be on toddlers and preschoolers. Any questions? Right, chapters 32 and 33. So toddlers, who are they? Toddlers are ages 1 to 3. We call them the terrible twos, right? And the reason is these are children that are so thirsty for knowledge. Remember, they don't even know how to breathe when they're born. So now they're toddlers and they're mobile, and now they want to see everything all at once at the same time. And that's why I love Seinfeld's express is saying here, having a 2-year-old is like having a blender without a lid on. Oh, turn it on. Poof, everywhere all at once, all the time. It's hard to keep up with them, and that's just part of who they are. And it's actually the beauty of who they are, okay? It is the time of temper tantrums. Me, my, no, 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 no. And it's that obstinance and being negative, right? Ever hear a toddler say, oh, yes, oh, yes. They always say, no, no, no. During this age, growth slows way down. Yes, they still grow, but it's very slow. Remember the head and the chest at this point. We know the head's going to be smaller than the chest, or at least equal to it. And we know birth weight is quadrupled by 2.5. As we get older, the heart and the lungs and the kidneys and everything don't have to work as hard as it used to. And they can, it's because they're more effective and efficient. So we know all of those systems are getting better. Another thing that's going on, we have a child, a toddler, intense exploration, and they're getting chronic upper respiratories, ear infections, tonsillitis. And the reason is they explore the world through their mouths. They put germs in there all the time, and you can't stop them. You can't keep it clean, ain't gonna happen. These children actually they need these germs in order for their body to produce antigens and antibodies, right? And it helps them in the future not to be as sick because they have that. Their gross and fine motor skills are getting more and more active, and they're getting more coordinated. We know that the refinement of coordination is somewhere between 2 to 3. We know somewhere about a year or so, they're using now both hands a lot better, both equally. And then at 18 months, be careful. They can throw a ball. And I know my grandson hit me in the head with one, and yes, it was hard. The sensory, the visual, the hearing. Now, toddlers, when they are little newborns, they are drinking this formula, eating this food, and they don't care what it tastes like, or maybe they think it tastes good, and they just eat, right? Well, toddlers are not like that. All of a sudden, their senses get a lot more developed, especially that taste. So they become absolutely picky eaters. They go into what we call a physiologic anorexic state. They hardly eat, but they're not growing much. So they really do not need to gain as much as we think or eat as much as they do think. As long as they're cognitively aware, they're gaining weight and they're happy kids, they're okay. Now, Erickson. Erickson talks about the people around a toddler. How do people respond to them? Well, what are toddlers doing? Toddlers are exploring the world, right? They're autonomous. Automatically, me, mine, I'm going for it and I'm going to get it. Automatically, me, mine. They are egocentric. That means me, mine, id has nothing to do with anybody else. It's all about me, okay? But there's always somebody, usually that helicopter mom, they're called, or helicopter grandma, depending, is that person saying, be careful, don't do this. Let me help you. I'll do that for you. No, that's wrong. Let me do it. Oh, be careful. You're going to hurt yourself. Have you let that child explore the world to understand what hurts, what doesn't hurt, why things are wrong, why things are right? That's when a toddler gets shame and doubt because they want to go, they want to learn, they want to see everything, but something's holding them up and making them say, I guess I shouldn't be doing that, huh? Shame and doubt, okay? We know toddlers are negative. I've said that. The thing that can Take a toddler and keep them the calmest that we can be is what we call ritualization. Let's just put them on a schedule. So a toddler being admitted to your unit on to be able to go to on your floor. Okay, they're being admitted. One of the things that we have to incorporate into a toddler because they don't like strange new places. So trying to keep them on the same foods that they eat if the diet allows it. Also, when is bath time? This is a big one, believe it or not. Children relate to bath time, bedtime, many of them, or they wake up, they eat breakfast, and they have bath time, whatever it is for that family. So changing that bath time, that kid gets confused. Also, the food's changing. All of these things put stress on these kids. So again, trying to keep bedtime, bath time, foods, all of nap time, trying to keep them on the same schedules provides comfort because they know what to expect. Now, their cognitive development, Piaget, right? Thinking, taking little things and learning. We know that sensory or motor is all about exploring. It's about touch, mouth, and movement. And it starts with knowing that even though I can't see it, it's here somewhere. Let me go looking. And that's object permanence. Remember, kids older. Now, that 2 and 3-year-old would be these toddlers. Now they're using a block and they're using it to be a car. They're using their arms and they're now their airplane flying all over and the broom and the horsey. And they're just into all of this magical thinking and making things play. That's some examples. I think one of the things here to show you how children learn, that big picture there, you put a toddler, the older toddler, almost, 2 years old. You put them in a high chair and they accidentally knock over their sippy cup or something off their high chair. What does mommy do? She goes running in to go pick it up, right? Goes, washes it off and brings it back in. Well, what have you just taught that child? Every time you knock off that sippy cup or whatever it was, mommy's going to come pick it up. So mommy can't go in the kitchen and finish dinner for everybody else. No, you got to be here next to me because that's what I want. Because I'm going to knock off that cup again. And that's toddlers. They're that smart. We know that autonomy versus shame and doubt. It's all about automatically me, mine, I want to do. Somebody's telling them or not allowing them to do those sort of things, okay? Now, toddlers, they're starting to know that they have different sort of privates. They know why. Usually it's potty training at this time, right? So they know mommy and daddy have different things. Daddy stands up, mommy sits down. Oh my goodness, what's going on, right? So now they start feeling themselves to see what they have there. Absolutely normal. Not uncommon to find several kids in a place by themselves, fondling and looking and, experimenting. And at this point, what should we do if we see that? Come on, let's go. Let's wash your hands. Let's go get a snack. Oh, we're going to go outside now. It's not a bad thing that they know the bodies, but just break up the situation that's occurring. That's that play in the house time. Social development on a toddler. These children, they don't like to be away from mom and dad. And into preschoolers, they don't like it. But give them something that gives them comfort. Could be a special blanket, could be a special toy, could be that special pacifier, could be a pillow, jammies, anything. Whatever it is. If you have it at the bedside, it helps decrease that separation anxiety that you do see. And that we call transitional objects, okay? That's something that helps them while mom and dad's not there. We know by the end of age 1, they're speaking one-word sentences. By 2, multi-word sentences, okay? We know these kids are getting independent, strong-willed, and trying to figure out the world. Terrible twos. So play. Children do this, and most people do, from the moment they wake up to the moment they go to sleep. You play. Now, what did I tell you about toddlers? They're all about me, mine, and I don't share. So you can play over there and you over there. I'm going to play here, but nobody's going to touch nobody's toys. Parallel play. They're next to each other, parallel to each other, but they're not sharing. They will not share. No. They can do imitation. And of course, they like all those tactile sands and things and touch. They love those things. Toilet training. Remember, bowel training becomes before urine. They actually can feel the stool more than they can feel the urine, although they say part of the readiness is having a dry diaper for 2 hours. And they're saying that's the time where you can start it. We know brothers and sisters are always going to be a problem. I had 6 brothers, 5 older and 1 younger. So I was the one that everybody was after because I was the girl in the house. She's going to get special things. She's the girl, not my house. Temper tantrums, toddlers, it's what they do. They don't understand yet. Okay. We know bedtimes always they're going to, I don't want to go to bed. I need a drink. I need a hug. I need another kiss. I need to go to potty. I need, right? That's part of the toddler. As I said, that negativism, no, me. It's all about me. And of course, any child, toddlers, preschoolers, especially toddlers, when they are stressed, they're going to regress. They're going to end up sucking their thumb again, being incontinent again. They're going to go backwards. Whatever it is they have to do, they'll do to comfort themselves. As I said, nutrition is that physiologic anorexia. Okay. Remember that they're growing still. And we know that there's all diets. There's some families that are only vegetarian and they're not eating enough, making sure that they get enough. That's always call in a dietary consult. Very easy. Doc, call in dietary consult. And absolutely they will. Also know nutrition can be used for conditions like, all right, you're lactose intolerant, you're not getting your calcium, you're not getting vitamin D. How are we going to do it in another way? Again, other foods, whatnot. Knowing things like increasing protein when they have wounds or have had surgery. This can help with wound healing, using food as part of the cure, okay? We know that there's all sorts of complementary alternative medicines. As long as it doesn't interfere with medical care, it's fine. Just like religious things. I just need to know who I am, what I believe in. I don't have to believe in what you believe in. I've just got to give you the opportunity to practice as long as it doesn't interfere with medical care. Okay? Dental health. We know they start coming in at 6 months. At first, we're just brushing them, no fluoride, no toothpaste. By the time they get to toddlers, now we're going to put toothpaste and fluoride in them. They do need to start with dental checkups once they start getting their teeth in. All their baby teeth should be in by the time they go to school. And they're going to start now falling out by age 6. Now, babies, children, everything in their mouth, right? We put this one in here, ingestion of injurious agents, and we put in here lead. It's not as common as it used to be, but there was a time where all paint had lead in it. And it's still on the walls in many places in old buildings, etc. And not every building is 2000 and above, right? So we know that there's going to be lead. Know that there is a treatment. We're going to go over chelation therapy one more time when we get to hematology, when we get to thalassemia. Again, it's an iron problem. We can either give a medicine by mouth, it combines with it, and it excretes it through the kidneys. Or using that machine, we can pull out just iron. Now, Kids, everything in the mouth. What if you have a kid swallow something and that parent doesn't know what to do? Or what should we teach parents? In case your child takes something in their mouth and ingests it, what should you do? Don't tell them to vomit. Don't tell them to put Apicac and make them vomit. No. Number one, call poison control. I work triage quite a bit in the emergency room, and kids come in with ingestions of all type. And the first thing after I get my vital signs, know I have a stable child, I call up poison control. They have the most up-to-date information. Now, if they called it home before they came in, they sent them to that emergency room, they're going to follow up. They're going to be calling in sometimes to alert us, hey, you're getting this kid in who had this. This is the treatment. So you're prepared and ready, because sometimes time is sensitive. All right. And they also follow up after ingestions to make sure everything was good. So again, poison, any ingestion, call poison control first. Safety promotion, injury prevention. This is always, and of course, infection control is always part of those things. Motor vehicle safety, remember, it's the number one problem for accidents in all age children. Car seats, we know toddlers up to age 2 can be sitting in rear facing. At 2, they go front facing. But again, make sure that the seats are snug and that fits properly. Being careful about drowning, burns, of course, falls, dropping them in when they have to, not leaving things with aspirations, et cetera, around. And that car seat. There are many programs that you can tell your parents about that they give actually free car seats out, or take your car seat, install it for you, and tell you how to use it properly. Again, there could be a fire station. I know the hospital I worked at used to do it once every month on a Saturday. And that's another one for you to look at. And then let's just go into toddlers. So, growth and development, when we go in now from the toddlers, we're now going to the preschooler. Preschooler, ages 3, you'll see books that say 5 or 6. They don't say school age starts till 6, so I say preschool is ages 3 to 6, okay? What happens at this time of their life? They start school. So what do we need to prepare these children for? Well, we need to encourage parents to read to them, to encourage school. And again, now we're going to have increased attention spans. They have to sit and pay attention in school now. They've not done this before as a toddler. Again, their height slows way down. Slow as the toddlers. Yes, they're still gaining weight and still gaining height, but it's still slower. Their gross motor and fine motor are going to increase in what they can do. They're psychosocial. Let's talk about Erickson. Let's talk about the people around that child and how they react to them. Well, Erickson, the sense of initiative, says that this child tries to do things for the parent or people, but they don't always get it right. So they do it wrong. And that is that anxiety and guilt and fear that they get because I don't know if I could do that because I don't know if I'm right, so should I? And that's what Erickson says. Now, Piaget, cognitive development, what he says is they're ready for school. And again, getting them ready by reading, having them in activities with other kids can help them understand other kids' relationships, and again, attention spans. So we're talking about mind getting bigger, understanding more. So now let's talk about concept of time. So up to age 6, they don't understand a clock. 2 o'clock, we're going to go to, they don't get that. They understand after lunch, mommy's picking you up. Mommy's going to be here after recess, after lunch. They understand time with events, not time. Okay? And again, magical thinking. They're taking blocks and they're becoming fairies and unicorns and all sorts of things. Kohlberg, preschoolers. What did I say about morality in preschoolers? Reward, punishment. There are good things and bad things. And if you do a wrong thing, there's a consequence for it. And if you do a right thing, there's a consequence. Either one has it. Now, preschoolers. These guys feel like if they fall down or they start to bleed, they get a cut, they don't think that bleeding is going to stop. They think their whole insides are going to come out. So, how do we cure bleeding on a preschooler? You better have a lot of Band-Aids in the house. I have every brand of Band-Aid, from SpongeBob to Spider-Man to Paw Patrol. I mean, it's crazy that one Band-Aid, one piece of blood, put it on there and they're fine and they keep going. Again, they're afraid. So it's a reality as a nurse. You make blood on a child, put a Band-Aid on it and give them an extra in case it falls off. Spiritual development. They only understand what's been around them, their significant others, usually their family, okay? Spiritually, a preschooler, they think that if something bad happens to them, they feel they're being punished by God. Like they came in, they fell down, and they broke their wrist. And I've heard this before. I broke my wrist because I hit my sister yesterday, and I'm really sorry. I didn't mean to. This is very common for a preschooler. They feel they're being punished. Sexuality in a preschool, again, they're getting more mommy, daddy dress up, and now they're getting exploration about what is sex and sexuality and babies come from. Again, ask them what they know before we start answering these questions. Preschoolers are getting more conscious about not walking around naked like they used to as toddlers. Social development, preschoolers, they are easier to introduce into new situations and strangers. They're not as the toddler that I don't want to go there. They tend to have less to go through. Again, this is a child that if we had to leave him in a hospital room, again, having those familiar objects with them, their blankie, their doll, their pillow, their jammies, whatever it is, those familiar objects do help. And preschoolers, we can find out through dramatic play therapy something that's gone on that upset them. Sometimes they come back from an exam and they're just really just too much upset about it. Like there's something not right. Did something happen to you during the procedure? They don't know how to express it. But if we make it play, they can show us. Social development, again, they're getting to be able to talk, express themselves more. I think their vocabulary gets really big. I know that they start making up these beautiful big words. I mean, my grandson Christian, teleportation. That was his big word when he became a preschooler. Everybody was teleported, and this teleportation is in the future, and we're going to teleport. I'm like, okay. But again, it's part of learning and understanding language and knowing that words mean things. Preschoolers don't need as much rituals. They don't have to be on routines as much as toddlers. Yes, they need some. They don't need you to lie to them either, just like toddlers. Preschoolers, most can dress themselves. Again, they like to please, like I said. They know who their family is through culture, religion. They know what they believe in. And as a preschooler, they're going to start challenging, as in, Johnny doesn't have to go to bed now, so why do I have to? Oh, he's only 4 years older than you. But again, they're going to start challenging. Preschoolers. Toddlers parallel play. They don't share. 2 or more, but they're parallel in each other. No sharing, no nothing. Now, associative play is preschooler. 2 or more kids playing together. They're all sharing all the toys, but they don't make anything. There's no goal. There's no end. Nobody wins. I mean, game of checkers, somebody wins, right? That's easy. How about you're building a racetrack? The racetrack is finished. Again, there is a goal. Sex education, again, just be honest with what you're saying, but find out what they know first. And one thing that they do recommend is to use correct anatomical words, okay? Not to be using, the little family words for a penis or a vagina. Again, there's one word for everybody. As I said, by toddlers, they're exploring their private parts. By they become preschoolers, it's not uncommon for a preschooler to masturbate. So again, we walk in and we see this, ignore it, get your hand out of your pants, let's talk, and all right, see you later. But don't make it a big deal so they'll have some anxiety about it. Preschoolers hate the dark, don't like to be alone. They hate big animals. They think they're going to eat them up. Oh, and ghosts are a big thing. I always tell my grandson, so when you see the ghost, could you tell them to come over here, say hello? I'd like to say hello to them, see if they need anything. So we make it less of what it is, but he still lights on everywhere. They're afraid of people associated with pain. What do you think we are? What do we do every time we see a kid as a nurse? We poke them, we pinch them, we everything them. Not uncommon for kids to have problems with speech, that 2 to 4, the end of toddler, beginning of preschool. Again, early intervention helps. Preschoolers, they're not going to be sleeping as much as your toddlers or your infants do. They do have some nighttime problems with sleep. One of them is actually night terrors. And they'll be asleep, but look awake, screaming. And it does happen, very common in preschoolers. They do say, do calm me down before they go to bed. Don't be out running around in a neighborhood, come in and say, all right, brush your teeth, go to bed. No, have them calm down first. Preschoolers have an increase in motor vehicle problems. Why? Think about preschoolers. They're now mobile. They're riding bikes and all sorts of things, right? They're going behind cars in parking lots and driveways. I've actually seen 3 kids ran over in a driveway by a car. 3. One, nothing happened. One was sick and one didn't make it. Again, all different outcomes. Preschoolers, they're mobile. You got to be careful. And of course, safety equipment. School. We're introducing new cultures. We're introducing new children and new cultures to them. So it's a sharp change from the home environment. Communicable diseases, we put this in here. The one that we do talk about is chickenpox. And yes, we get chickenpox even with a vaccine. I've seen it over and over again. Know that chickenpox, you have to be out of school till all of those vessels are all dried over. And if we get a child into a doctor's office, urgent care, ER, and we're suspecting chickenpox, remember it's airborne. We need to put a mask on us, an N95, and we need to get them in an airflow room. That's chickenpox. It can spread and it can hurt our immunosuppressed children. They get eye infections a lot, teaching them about hand washing and changing it, their sheets, pillowcases, etc. They can get these infections, the stomatitis, those mouth sores. Again, it's hurt. It hurts a lot, making sure they get the proper medicine and pain control. We have roundworms. We have pinworms. How do they get those things? Well, what do kids do? They play out in the dirt. right? And eggs from animals and stuff, flies and worms and whatnot, get underneath their nails. And then what do kids do? Everything in their mouth, right? So now the eggs go in their mouth, they go through the GI tract, and all of a sudden they get intense perianal itching. Worms are crawling out of their anus, and usually at night. So, how do we manage these things? Well, number one, you've got to diagnose it by getting a worm. So, how do we collect this specimen? At night, with a flashlight and a piece of scotch tape, and you open up the buttocks at the anus, take the scotch tape and put it right on the anus and pull it off. Hopefully, and they're itsy bitsy, tiny itsy bitsy things, these little pinworms. Know that if a child has pinworms, check the whole family. It's very contagious. Child neglect, we've talked about it. We've talked about mush housings already. Know that it is real. Your job as a pediatric nurse is the safety of the children. It's better to be safe and report them to have a kid go home for more abuse. So parents tell the nurse that their 3-year-old daughter and a male cousin of the same age have been inspecting each other closely as they use the bathroom. Which of the following is the most appropriate response by the nurse? They're just preschoolers.
B.
Neither condone or condemn. No, what you do is, all right, come on, let's wash our hands. Let's go get something to eat. Or come on, let's go watch a program. Oh, it's dinner time. Let's go outside and play. Distract them. That's it. That's all you do. Okie doke. Let's go to the next one. Any questions? And I'll leave this open again for you. But again, use your cameras. It's easier. I had a question from someone who asked about nutritional benefits of lactose milk free versus normal whole milk. It's the same nutrition, but it's just the difference. You're not getting the difference in maybe the calcium or some components missing that you would need. But usually the nutrition is usually the same.
Okay, can I ask as a follow-up to that
Sure.
if the baby is on like after they're one, obviously, but if they're on like soy milk, is there something that you should do to like supplement the calcium and vitamin D?
Well, we can give them foods high in calcium and D, or we can give supplements.
Okay.
It depends on how, remember, toddlers don't like to eat. How are you going to get it into them? And if you can't, always a supplement.
Okay.
Okay. All right, let's get going. There's 20, what again? Something like that. 28. Types of play considered to be sense pleasure. I used to let my kids after dinner every night get into something and let it smush it all over, be in their hairs or nose or mouth, it'd be everywhere. But it was so fun to watch them just play with it. And they get their bath when they're done. And it's part of cognitive awareness, using their fingers, being aware. Sand, finger painting, mashed potatoes, any smushy stuff. What type of play is considered cooperative play? We didn't talk that one, did we? We talked associative, which is preschoolers. We talked parallel play, which is your toddlers. Cooperative play is your school-age children. Remember, 2 or more children playing together, but there is a goal. The goal here is checkers. Somebody wins. It's not the sharing. Cooperative, they cooperate together. School age understands how to cooperate together. They share, they play, and they make something, or somebody wins. There's a goal. According to Kohlberg's pre-conventional level of moral development, a preschooler has moral reasoning. What? What is moral reasoning? Well, we know that toddlers have absolutely no anybody but themselves, right? It's all about automatically mine, me. Now, there's an IDS, they have no about right and wrong. When they get to be preschoolers, they understand right and wrong, and they understand there's a consequence for each. We make it clearly said reward and punishment. Which nursing action is appropriate to teach a preschool age child about a scheduled procedure? Again, preschooler, ages 3 to 6. So again, after we get down on their level, we get on their developmental level, talking to them, yes, then we can use a doll and we can use play and all of these things to explain. And again, don't ever lie to a child. If it's going to hurt, let them know that it will a little bit, but you'll do everything possible so it will hurt the least as possible, and it's temporary. Before performing a physical assessment on a toddler, the nurse should do what to encourage cooperation? Toddlers, physical assessment. What do you do first? First of all, you're going to use minimal contact first, right? Because if you don't use minimal contact, and if you don't get down on their level, it ain't going to get to the point of play. They're going to be running in the opposite direction. So get down on their level, minimal contact, and then absolutely toddlers love to use play as part of, doing the assessment and touching the equipment. A 3-year-old child's having an outpatient procedure. How would you help the child to be less fearful? So, 3-year-old child, there's nothing here that tells you have to get down on their level, that you have to get on their developmental level. There's nothing like that. It's not from least to most intrusive. We are at the point. Yes, we're going to give them a doll and we're going to explain it to them. Before assessing a 4-year-old child, what techniques would you use to approach this child? So, 4-year-old child, you got a preschooler. So they're not like toddler, they're a little bit easier to approach. These are the kids. You see a Batman shirt, you see curly hair, freckles, neat lidded up sneakers, something. Tell them something's really cool and ask them questions. And these children will lighten up and they will start talking to you and trust you because now you're not threatening, you're fun. What technique can be used to examine a toddler? So get down on their level, be developmentally appropriate. And then what are you going to do? You are going to this little child here, you're going to use play on the body parts. It just makes it not threatening at all. Now, when would you listen to heart and lungs first? That's a good question that was brought up with this question. If there was an infant asleep, that's what I'm going to listen to right now. Or even a toddler. If they're asleep, absolutely, that'd be the first thing I'd listen to. Okay. But if they're awake, I'm doing an exam, I'm going to assess body parts, I'm going to play. When assessing a healthy child's lymph nodes, what would you expect? They're healthy. So lymph nodes are there to become enlarged so that it can fight infections when a child has it. If a child is not sick, you shouldn't be able to feel a thing. Non-palpable. Which Erickson stages of developmental levels would be used for a toddler? So autonomy versus shame and doubt. Remember, Erickson, toddlers, automatically me, mine, mine. And that's how you remember the toddlers. Automatically me, mine, mine. And it's that parent, so don't let them do things. What pain scale would you use on a 3.5-year-old child? So after age 3, it is faces. From 0 to 3 and nonverbal children, even an 18-year-old cerebral palsy, nonverbal is FLAC. Numeric starts at age 8. Multi. Erickson's autonomy versus shame and doubt is used to describe toddlers. What does it mean? So we know toddlers wants to go out, they want to explore, they want to do things by themselves, and they need to be trying new things. And that's how they do learn, okay? We know that the parents not allowing them is giving them that shame and doubt. Can they play all by themselves? Actually, yes, they do. That's all they do is play by themselves. A 2-year-old boy is playing with mud and dirt. What type of play is that? So anything, mud and dirt, this is that sense pleasure again. A parent of an 18-month-old boy says he says no to everything and rapid mood swings. Why is he doing that? No, 18-month-old boy saying no is absolutely what a toddler is. Automatically me, mine, no, 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 no. Egocentricals, all about me is all they know. And yes, they are in those rapid mood swings. Normal. What is descriptive of the preschoolers' understanding of time? What do they know about time? So preschoolers do not understand a time on a clock. What they understand is after breakfast, we're going to go see Nana. Tomorrow, when the sun comes up, we're going to be going on vacation. Daddy's picking you up after school today. This is what they understand. They don't understand time, morning, noon, afternoon. No, they understand events. What age would most children could understand under, on top of, beside, in back of, over, around, next to? So this is actually age 4. Many of you did put age 3, and it's not uncommon. What I suggest, forget you have children, you've seen children, you have grandchildren, because it's what the book says. And I know many children do it at 3, but the book says age 4. So again, it's hard if you have kids this class because you want to infer your own personal experiences. You can't. Be very, very careful. In terms of language and cognitive development, a 4-year-old child would be expected to what? 4-year-old preschooler. So preschoolers can follow simple commands like this right now. They understand, take your clothes and go put them in the laundry. Get your shoes, go put them in the closet. They understand simple commands. They don't understand conservation of matter yet. And abstract terms, that's your adolescent. That's your older person. What pain scale would you use to assess the pain of a toddler? Well, how old are toddlers? Their ages 1 to 3. What's your scale? And it's your FLAC scale. Does not turn faces till after they're 3. And you can use faces scale from 3 on, even adults, but we do change it to numeric. A multi. What are the cognitive characteristics of a child, ages 2 to 7, in the pre-operational stage? Remember, this is your magical thinking time, right? This is now, they still don't understand people yet, okay? They're still too young. They don't get it. They only understand themselves. They're trying to, but not quite. They're extremely imaginative, creative, magical. And again, they're using, a broom for a horse and arms for an airplane or whatever it is. And logical, again, not till adolescent, if you're lucky. A 2-year-old has difficulty in activity, sensory sensitivity, and has only speaks one-word responses. How do you assess that? Now, I put this one in here to let you know. There are different types of checklists for children according to what you are seeing. Find whatever your organization uses and then use that whatever that checklist is on them. This child, maybe there's something cognitively delayed there, that sensory sensitivity, not speaking a lot. That could be Downs, that could be autism. So again, yes, this happens to be the modified checklist for autism toddlers, but again, know what your facility has. What fine motor skills is expected of a 4-year-old child? Fine motor skills, F fingers. If you're skipping and walking, your gross motor skills, your get up and go, go, go. I didn't say anything during that question because I wanted to do this to you. Read the question. F, fine fingers, button, shirt, tie, shoelaces are the only answers there. Tie and shoelaces is age 6. It's way too big for them. So the answer, button a shirt, F fingers. Multi. What gross motor skills should a 4-year-old be able to do? Good job. Nobody chose a fine motor skill. Whoop, whoop. Yes. Walking, hopping, jumping. Yes, they do all of those things. But again, these questions I'm showing you, how do you pick the right one? Fine motor, gross motor. They're tricky. And the questions, you will see them. Multi. What would alert the nurse to hold the digoxin on a toddler she's caring for? Remember I tell you need to know vital signs? And this could be one of those reasons and why. I mean, the question might not be just like this, but remember, digoxin is for a child as it is for an adult. The only change is the heart rate. We know heart rates are held for less than 60 on an adult, but for a child, it depends on the age. Yes, you're still going to measure potassium because you can go to dig toxicity, same thing. Dig levels have to be 0.5 to 2, have to be within it. And that heart rate, that might be okay for that child. But if I'm not sure, I'm going to hold it. I'm going to call the doctor and I'm going to check it. And pulses have nothing to do with digoxin. How can you prevent otitis media in children? So again, one of the things we can do is that exposure to smoke. Absolutely. We know breastfeeding on infants can help, but the big thing that we're coming to here is that exposure to smoke. No cigarettes. A 4-year-old is reluctant to take medicine. What intervention should the nurse to take to try to make that kid do it? I can't tell you, working in an ER the last 10 years of my career and trying to get medicines into preschoolers and toddlers. It's not easy. So this is what they tell you to do. Does it work? Sometimes yes, sometimes no. But what they tell you to do is to do a straightforward approach. Now, if you're going to mix it with food or medicine or juice, as long as it's this much and you can know that they took the whole thing, you're all right. But if you put it in a bottle and they don't drink the whole bottle, how much medicine do they take? So you can't do it that way. Maybe a little bit of applesauce, a little bit in it, take the whole thing. Yes. But what do they tell you to do? They tell you to use a straightforward approach. And that means, do you want a pill or do you want liquid? Would you like a spoon or would you like a cup? And would you like something to drink when you're done? Straightforward. Give them a choice. That's what they have to have. And hopefully they'll take their medicine for you. Which intervention helps a hospitalized toddler feel a sense of control? Remember, toddlers, the big thing is routine, routine. If we can feed them the same foods, that would be great. If we could keep them on the same routine, absolutely. And this doesn't even mention it, bath time is huge, especially when you're cognitive delayed children. That absolutely has to be, if it's night or morning, whatever it is, keep it the same. That child knows what's coming next. A multi. A child's been admitted with profuse diarrhea for 2 days. What are you going to expect? Now, I will be putting ABG questions in here. There was one, HESI. I saw 4 ABG type questions in it. So I'm going to try to explain it in a manner that you guys are going to remember it for med-surg too, okay? So if you're having diarrhea, you're losing fluid. So yes, you have to worry about potassium. Diarrhea has digestive enzymes in it, which are alkaline. So alkaline is being lost from diarrhea. What is left in the body? Acid. So you're going to be low potassium and metabolic acidosis because you've lost alkaline because that's what the diarrhea is. Okay. What happens when you vomit? Well, You're vomiting acid. You're losing acid. What is left? Metabolic alkalosis. Can that help you to remember the differences? Vomiting, diarrhea. And the other one you need to know is respiratory alkalosis, and that is hyperventilating. And last question, normal language skills for a 3-year-old child. So 3-year-old child should be about 4-word sentences and absolutely normal. If it's less than that, again, we might need speech therapy. It needs to be evaluated. Let's see how we did. Number 3, Tempest. Good job, Tempest. Number 2, Mercy. Good job, Mercy. Number 1, drum roll. Bing, bing, bing. Tara. Good job, Tara. And Jennifer and Avery. All right, remember you only have a discussion question that's due this week. You've already taken your quiz. Yes, you'll have another quiz when you come to class next week. It's on this stuff, this information from this week. Remember, next week is all of your reviews. As soon as I get the reviews, I will post them in one announcement, and I will let them re-inform you when I set up a new posting. It'll say, do you want me to message? Yeah. Go ahead, tell them yes. Another one is in so that you will know it's there. You do the study guide, you know the cahoots, you're going to be fine on this exam. Theorists are very hard hit, so be careful. Please think about what pediatric diagnosis you want. Okay, anything is good. You don't have to have a child. You can have an imaginary child, or you could have a diagnosis you want to know, or a friend, a neighbor, anybody. Tell me something you want to know. It's actually a good week to start your paper, to start to get that done, because week 8, you're going to be right up to here, and you're going to wish you listened to me. Anyway, guys, you have a great evening. I see y'all next week.
You too. Thank you.
You're welcome.
Thank you. Good night.
Good night.